This year our strain of influenza predominantly is the H3N2 strain, and that strain was actually included in this year's vaccine. But what we know is the protection from our vaccine is about 30 to 50% effective. What that means is people still can develop influenza infection despite receiving the vaccine. Influenza is a virus that evolves slowly over time and can evolve such that our body's immune system doesn't 100% protect us. But what we do know is that if you receive the influenza vaccination and you do develop influenza infection, you're less likely to have severe complications and to develop the other complications that we often see, brain problems, muscle problems. Those things happen less when patients receive influenza, and they come to the hospital less if they receive the vaccine. So even though you will hear reports the vaccine is not 100% effective, it is still important to receive the vaccine in order to prevent the severe complications, and it might reduce transmission to other people. This year, what we know is that people are having very similar signs and symptoms. H3N2 can cause severe disease. Those symptoms almost always start with a fever, muscle aches, you can have headaches, and you almost always have a respiratory tract infection, which can mean anything from runny nose, sore throat, and cough. So if you do develop those symptoms, there's a few things we need to talk about. If you have chronic medical problems, if you have chronic kidney disease, heart disease, lung disease, for instance, you have asthma and you're on steroids, or if you have immunocompromised states, like certain disease states or cancer, you're on chemotherapy. Those are the things that we really want to make sure we get those people taken care of. If you are young and healthy and you're between the ages of maybe 5 and 65 and have no medical problems, the odds are that your healthcare provider may or may not want to test you and subsequently give you treatment, because we know that it's usually a self-limited illness. Things change if you're a healthcare worker and you work in a hospital. We're going to want to get you treated so that you shorten the duration that you can transmit to other people. If you do think that you have influenza and you need to be seen, there are several avenues to do that. We ask that patients not show up unannounced into the emergency room, because usually when you have those symptoms, you're fairly contagious, and we don't want people in the emergency room with broken arms getting influenza from unannounced patients. So you probably want to call your primary care provider, and they will decide whether or not you need to be tested and subsequently treated. We have walk-in clinics at Walmart and Hy-Vee, and there are other urgent cares, and there are the Direct Connect facilities whereabouts you can go online at CoxHealth.com and you can see a provider remotely, and they can assess if you need to be tested and subsequently treated. We do treat patients. Not everybody needs to be treated for influenza, but if you're at those extremes of age, if you're less than 5, older than 65, if you have those chronic medical conditions, or if you have severe complications, if you're being admitted to the hospital, obviously, those people, we want to make sure that we get them on prompt treatment, and typically we use the medication Tamiflu. Some of the things you want to look out for: if you have symptoms after 7 to 10 days, there can be secondary infections. People can get bacterial pneumonia on top of influenza. If you're having shortness of breath at rest, those are the sorts of symptoms that you may want to be evaluated. Otherwise, most patients with influenza with symptomatic relief with fluids and medications like acetaminophen or Tylenol and ibuprofen to control the fever, cough medications over the counter, most people do fine with influenza. It's just those extremes of age and those chronic medical problems where we want to make sure we get those people treated. So make sure, wash your hands, hand hygiene with alcohol-based hand gels. Try to avoid public places if you're sick. We ask that people cover their cough, and good luck battling the flu epidemic this year. So thank you very much.